Bengal, and tonight there are serious questions over what exactly went wrong. 60 children have died at Malda Medical College and Hospital in just the first 3 weeks of August. And the most disturbing detail is that 10 newborns died in a single day. I mean, think about it. 10 tiny lives lost within hours, 10 families left devastated. And now the West Bengal Health Department has demanded a detailed report from the hospital as it begins a wider review of the deaths. The deaths were reported during the second week of August. Of the 10 infants who died on that single day, 8 had been born elsewhere and were brought to Malda Medical College in a critical condition, quote unquote. Only 2 had been born at the medical college itself. Doctors say the newborns were suffering from serious complications, including respiratory distress, jaundice, congenital heart problems, and the sheer number of deaths in such a short period has triggered an investigation into the matter. The numbers reveal a crucial detail. Of these 60 deaths that we're talking about tonight, 44 involved babies born at other medical facilities and later referred to Malda Medical College after their conditions deteriorated. That has now put the spotlight not just on the medical college but on the entire chain of treatment. The State Health Department is examining where these infants were initially treated, what happened. The review extends to private hospitals, nursing homes, block-level health facilities and other government hospitals. Officials have already inspected 16 hospitals and nursing homes as part of the probe. The key question is whether these critically ill infants were referred in time and whether they received adequate care before reaching Malda Medical College. Malda Medical College Superintendent Prasenjit Bar has confirmed the deaths. He says 8 of the 10 babies who died on the same day had arrived from outside facilities in critical condition. The hospital has already submitted a preliminary report to the State Health Department. A detailed report is now being prepared. But even as that happens, there are several questions. The West Bengal Health Department wants the full picture, and so does the public. What condition were the babies in when they arrived? How long had they been treated elsewhere? Were referrals made quick enough? And were adequate neonatal facilities available at the centers where they were first being treated? The Malda District Magistrate is also scheduled to hold a meeting to review the situation and discuss the findings. The deaths have now raised concerns about the wider neonatal healthcare system in the region, because behind every number is a family. A newborn who was supposed to be coming home, a crib that may now remain empty. And for now, the state has begun asking questions. And for the families who have lost their babies, the biggest question remains, could something have been done to save them? Padma Shri, Dr. Sanjeev Bagai, Chairman, Nephron Clinic, with us on the broadcast. Many thanks, Doctor, for patiently waiting. My apologies. Doctor, you see, these 10 neonatal deaths in a single day, of course, the number is 60 in a span of 3 weeks. In a single day, 10 deaths. Can all these numbers ever be explained simply by the severity of the illness? Or does this number, this news, warrant a deeper clinical audit? What's your take on this, Doctor? Doctor, beg your pardon. I think you'll have to unmute yourself, Doctor.
Sorry.
Yeah.
So the only answer which we can give actually for this unfortunate story is that there is callousness all across. There is a sheer neglect of healthcare right from the primary level sources. If you look at the diseases or the illnesses which have been documented, it shows extremely poor antenatal care. Antenatal ultrasounds perhaps were not of good quality. Congenital hearts can be diagnosed from 14 weeks of gestation age going onwards. Why were they not picked up? What was the diagnosis at the time of birth? What was the screening done, newborn screening done? And of course, the other facilities which require ventilatory care, oxygen supply, sterile beds for kids who are in respiratory distress, checking for jaundice at an early age so that we don't let that go out of hand, because that damages the child's brain permanently. Now, these children, if they are referred to any referral center or a government hospital at late stages, the death rate is almost 100%. It's virtually impossible for anyone to gain control on the mortality once a newborn goes out of control.
Yeah.
The big bad H's in newborn is hypothermia, that means low temperature. Hyponatremia means low sodium. And more importantly is hypoglycemia, that means low sugar. And all these three are a corollary, a direct fallout of infection, which you call as sepsis, delayed respiratory care, which is because of the respiratory or lung condition, or indeed prematurity. We need not an audit now, we need an audit of the last 10 years. I'm not belonging to any political party, but the Previous government has been there for the last 10 years or 12 years or 15 years. Why are the government officials and the people who were holding posts at that time, why are they not being held responsible? The healthcare facilities cannot come up overnight. What was done for newborn care? We still are having a very high under 5 mortality, which is 27 per thousand live births. We are having a neonatal mortality of 17 per thousand live births. We are having an infant mortality rate of 28 per thousand live births. We have very low newborn care facilities all over the rural India, especially in places like West Bengal. We have 66% incidence of anemia in small children. Someone needs to give an answer.
Yeah.
There's a very old and famous saying, I am today what I was yesterday. I will be tomorrow what I am today. If we don't look after newborn care now, we will have a sicker, smaller child population, sicker adolescent population, and a much weaker adulthood, and which will be ridden with diseases and illnesses which are largely preventable.
Doctor, 44 of the 60 babies had been born elsewhere. That's what the Malda hospital is continuously saying. That's what the medical superintendent is continuously saying. They were referred to Malda after their conditions deteriorated. What does that tell us about the quality, the timing of the neonatal care before these referrals actually happened? You spoke about callousness, but help us put these numbers also into perspective. 44 of 60 babies born elsewhere, referred to Malda after their condition deteriorated. For a critically ill newborn, how crucial are the first few hours? Let's paint that picture for the public as well.
Yeah, so the main focus is now, if a child is really critically unwell, even 15 to 20 minutes of lack of oxygen or lack of ventilatory support is goodbye for the newborn. Within an hour or two with low sugars or low sodium or low calcium, it's goodbye to the baby. When you're looking at without adequate cover of broad spectrum antibiotics in case there is neonatal sepsis, more than few hours, it spells danger. The real issue is, where is the ambulatory support as far as transportation of these newborns is concerned? Do we have a worthwhile ambulance in West Bengal? Do we have a worthwhile transport facility at all, even in Calcutta? These answers have to be given for the sequential governments for the last 2 decades. How is a critical newborn going to be shifted? Most of the time you see these horror stories in which really anxious parents are carrying a very sick, gasping, literally dying newborn in their arms. Is that the way to treat a child? Is that the cost of a human life in India? Is that what we want in newborn care? The answer is no. We need an audit. The audit must be made public. Hold the people who've been responsible, name them, shame them. Unless until you don't put punitive damages on every government servant in West Bengal who has literally let the country and humanity down.
Yeah.
We've seen fires in newborn units. We have seen a gang rape of a resident doctor in Calcutta earlier. We are seeing these kind of stories which are largely preventable. It's just sorrowful to hear this, that no one actually cares in West Bengal.
Which is why I wanted to bring this up again, because I remember, Doctor, you were with us when we were discussing the NICU story, the tragedies that happened. I've got 2 more follow-up questions for you, Doctor, before I let you go. When a sick newborn is transferred between facilities, you just told us, there needs to be a deeper clinical audit into the same. What should a proper referral system look like? You spoke about ambulance and transportation, but what about stabilization? So from stabilization to transport to the information handover at the receiving NICU, what does a good, setup and a proper referral system really look like?
Yeah, so when you're shifting a newborn, especially in a critical stage, you have to have a well-oiled machinery and engine better than a Ferrari or a Rolls-Royce. Make no mistake about it. You need a proper referral system. A bed must be arranged. The temperature of the baby, sugar of the baby, IV fluids of the baby, and oxygen supply. That means ABC, airway, breathing, circulation. ABC is airway, breathing, circulation, the 3 vitals to transport the baby. You need a neonatologist and a trained nurse to accompany the newborn, and someone there at the receiving hospital to immediately shift the baby to the NICU care. You can't let a baby go unattended. Unattended means 100% case fatality. Transport medicine, arrangements, coordination has to be immaculate. Yeah. Unfortunately, obviously, that's not there.
And lastly, Doctor, this investigation that is now happening, because these numbers, and I don't want to make this about one particular hospital, because there is trauma across the country when we're talking about the newborns. Ultimately, what should this investigation now bring out? What should this investigation establish?
So the investigation, one is where the cracks are. Those cracks have to be filled up ASAP. And that's not going to happen overnight because there will be an acute shortage even of trained manpower and neonatologists in West Bengal. So we need to look at the manpower, the human resources, as far as our capital is concerned, very carefully. We need better infrastructure, more NICU beds, more ventilators, more trained staff to manage that. That is the nursing staff. More importantly is we need to find out where the pathway forward is. Therefore, we have to identify where we are and where we should be. Put a timeline. Every quarter, make the report public. Every annual report, make public. Show a progress graph. That reflection has to come in neonatal, infant, and under 5 mortality figures. That has to decrease in West Bengal. Again, I'm saying, unless and until you don't hold the people who are responsible by the scruff of the neck, make them accountable, put punitive damages. This is criminal negligence as far as I'm concerned. Even to lose a single newborn is unacceptable.
Absolutely. Padma Shri, Dr. Sanjeev Bagai, many thanks for taking on the time yet again, Doctor, for speaking to us here on News 9, bringing us up to speed with your insights on this story. 60 newborn deaths in 3 weeks is a number that demands answers. The investigation will have to establish all those things that Doctor just told us about, whether these were unavoidable tragedies, where are the cracks, or whether some lives could have been saved with earlier referrals and